Hi, my name is Shannon Domfort. As we have been discussing, our current healthcare system is far from perfect. Due to high costs, a fragmented system, and an imperfect market, access to healthcare is a major issue. Within the system, there are special populations that are at a heightened disadvantage due to increased vulnerability. I am going to focus on the underserved population of those living in public housing communities. Currently, over 5 million American families receive some form of housing assistance from the U.S. Department of Housing and Urban Development. Of these families, approximately 1.2 million live in traditional or tenant-based public housing communities. Within these communities, 69% of the tenants are from racial and ethnic minorities, with 46% being African Americans. The ideal behind these housing communities is that they offer internal community support due to shared community identification, effective connectedness, collective efficacy, and residential stability. This secure base would allow families to go out and seek health resources. However, quantitative data does not support that this behavior actually occurs. While public housing communities enable internal support, it does not provide external support that actually leads to better health outcomes. According to the vulnerability model, vulnerability is a multidimensional construct. This means that there are many factors that interact and converge to influence a population's and person's health outcomes. Unfortunately, people within public housing have an increased vulnerability as they are faced with a combination of predisposing, enabling risk, and health need characteristics. As already mentioned, public housing communities are disproportionately made up by minorities. It is already known that being a minority is associated with less access and lower quality of care. The social structure of these communities also lead to increased vulnerability. Public housing communities have high neighborhood crime rates, high population density, poor neighborhood living conditions, and few community resources. Living within these communities also results in families experiencing social isolation, leading to increased vulnerability as they may feel like they do not have access to external support outside of the public housing community. Public housing is owned and operated by housing authorities receiving federal funding from the U.S. Department of Housing and Urban Development. So families, elderly, and disabled persons with low incomes can qualify for public housing. There is already a known relationship between lower income families and decreased health. Since these communities are meant for financially at-need individuals, they also may experience discrimination on the account of financial status. Due to their lack of financial resources, they may not have access to the care they need or education. One study found that residents were not involved in health activities because they did not see them as important, as many residents have little knowledge about their health, which makes prevention in general a very low priority. The study found that residents did not really understand or know about many of the health issues that are more common within public housing communities than in the general population, such as cardiovascular diseases. Mediating factors are associated with the actual use of healthcare services, which is very low among this population. A study conducted with poverty-level residents of the Seattle Housing Authority found that over 90% of the population knew where to seek healthcare, showing that in this case, knowledge was not the barrier. However, over half reported difficulties accessing care, and 16% reported being denied care. People within this population are facing both transportation and financial barriers when trying to access adequate health care. If they can't even get to health care, how can we begin to focus on increasing the quality of care? While this special population lacks the resources to obtain health care, they are at a heightened need for these resources. Families within public housing communities are more likely to have medical problems, mental illnesses, excessive alcohol and drug use, greater risks of violence in comparison with family vouchers. Evidence suggests that families have better health outcomes after moving out of public housing and into mixed income communities. which is what the vouchers allow. Residents are also 1.8 times more likely than non-public housing residents to suffer from anxiety orders. A study in Baltimore found that 37% of older public housing residents had need for mental health care. 58% did not receive these services. Here's a couple discussion questions to start thinking about how we can positively influence this special population's health outcomes. Since residents of public housing are at a heightened vulnerability due to the convergence of several factors, what could programs specifically target to increase health outcomes? Also, some programs discuss providing care within the communities to decrease transportation barriers, but could also increase feelings of isolation and result in less quality care. How do we decide what factors are a priority for these special populations?